Alright, so I'm gonna wash my hands. Let me come into the room.
You come in.
Awesome. Hi, my name is Derek. I'm a student physical therapist. I'm going to be working with you today. Can I get your last name and date of birth?
O'Connor, 3/23/59.
Alright, you're the person I'm looking for. So I guess just what brings you in today? Give me a little backstory here.
My right hip hurts.
That doesn't sound like fun.
No, it's been going on for 2 months.
2 months it's been bugging you and now just getting the therapy. Okay, did you see a doctor or anybody beforehand?
Yeah, he told me to stop playing golf until the pain's better.
I'm a fellow golfer. We can't have that. We got to get back to golfing as soon as possible. So in regards to the hip pain, can you describe it? Like what symptoms, what sensations are you feeling? Is it stabbing, burning, aching? Just give me a little backstory there. And if you had to rate it on a scale of 1 to 10, what would you say it's at?
It's in my right thigh.
Okay.
Or no, I'm sorry. It started in my right thigh, and then it's a continuous throbbing pain.
Does that feel like deep on the surface? Deep, or does it feel more on the surface? How would you describe it?
Deep.
Deep, okay.
It starts in the right hip and spreads down to my knee.
Okay, and what sensations are the spreading? Is that the achy? Is it numbness, tingling? How would you verbalize that?
Throbbing.
Throbbing, okay.
I feel like I walk with a waddle.
Okay. You mentioned earlier that you did see doctor. Did he give you anything besides golf that he doesn't want you doing?
No.
Okay, so golf was a big one. Did he give you any medication in regards to the hip pain to make life a little bit more manageable for the time being?
No, I just take ibuprofen.
Okay. Ibuprofen, does it help? Does it not help?
Not really.
Okay.
Helps a little.
So again, if we're thinking about numbers of pain, 10 being the worst pain ever, 1 being not so bad, what does it start at, and after you take ibuprofen, what's it go down to?
If I stay in one position, if I stay in one position, feel like I constantly have to fidget to get a comfortable spot. I can't sit for more than less than 10 minutes.
Okay.
At least it's a 3, at worst it's a 7. Climbing the stairs is usually worse, causing my pain to go up to a 7. It wakes me up from my sleep. I can't lay on my right side. Nothing makes it feel better.
Oh, that doesn't sound enjoyable at all. So the pressure, like laying on your right side, the pressure on your hip hurts.
Yeah.
You do see that people with hip pain tend to have more pain going upstairs. It's primarily because you use your hip joint a little bit more. Going downstairs still probably isn't great, but you tend to use your knee more, so it might not be as bad. And that kind of leads me into a little bit of, in your home environment, is there something you have to do on a very regular basis, or work too? Do you work or no?
No.
No. Okay.
I volunteer 1 day a week at the local hospital.
Nice. Are you retired?
Yeah.
Okay.
I was a secretary.
Oh, how'd you like that?
Good.
Good. How many years did you do that for?
A while.
Okay. So stairs. Let's go back to kind of thinking about at home. Are stairs something you have to encounter at home on a regular basis?
Yeah, there's 5 steps into my house.
Okay.
I'm in a 2-story house.
Not ideal. In regards to like bathroom, bedroom situation, kitchen, are they all on the same floor? Are they different floors?
No, my bedroom's on the 2nd floor.
Okay.
There's 14 steps to the upper floor with railings.
So every time you want to go up to bed or something, you have to climb the stairs, which doesn't sound fun.
Yeah, and I do laundry a lot, and it's in the basement, which is 12 stairs.
You're retired, you're still working your butt off. I respect it. Bathroom on the 2nd floor, or is that on the 1st floor? Not sure about your own household?
So, one on each.
Okay, 1 on each, which is good. Is there railings on any of that or anything of that nature?
There's railing on the right side when you walk into my house. There's both railings when you go upstairs, and there's a railing on the left when I go downstairs to the basement.
Okay. And as we go forward, those kind of things matter because they'll kind of determine how our treatments go and if we want to use upper extremity support or not. We'll see. See what happens. Anybody at home to help you? So are you doing everything at home yourself, or do you have a little bit of support?
I live with my spouse.
Oh, nice. How many have you been married? Or together?
Seems like forever.
Seems like forever? Okay. Fair enough.
Happily.
Are they retired as well?
Yeah.
Okay, so you get to spend a bunch of time together.
Hang out every day.
That'd be fantastic. I would love that if I could do that with my wife every day. Anything in history of like medical history that has been with the hip pain? Like, is there anything that you think could correlate to the hip pain or anything of that nature?
I have no injury, but I have a history of rheumatoid arthritis.
Okay, there could be a correlation. Anything else?
I had back surgery 5 years ago that fixed pain rating down my left leg and my L4 and L5 disc, and I had right hand surgery 3 years ago.
Okay,
due
so
to a tendon rupture.
since the back surgery, the pain has been absent, hasn't been there? And
Yeah.
Okay. In terms of the radiating pain down the leg, that hasn't been there?
Yeah, my left side, that's gone.
Okay. That's good. This is good. Sometimes you do see a correlation between back and hips. Everything's connected, so something we'll have to kind of keep in mind. And then before this hip pain, so we'll go back a few months. Before the hip pain, obviously you kind of already mentioned you were golfing. What else were you kind of doing, so I can kind of see what we want to get you back to?
I volunteer at the hospital, like I said,
Yeah,
one day a
remember you
week.
saying that.
But I haven't been able to the past month due to pain.
So we'll get you back to doing some of the volunteer hours in golf. Anything else?
I do a lot of laundry and cleaning still. My spouse has had to help me because the pain's been bothering me.
Yeah, it's good for him to a certain extent.
I enjoy cooking and golfing, like I said, and playing cards with my friends once a week.
Oh, that sounds really fun. What kind of cards do you play? Blackjack?
Poker.
Poker. Oh, got a good poker face?
Yeah.
Awesome. Okay. And then when you were doing these activities in your past, none of them provoked hip pain at all. So before the hip pain started, when you could do everything you just listed without pain.
Correct.
Okay. Let's see here.
I also go out to lunch or dinner 2 to 3 times a week with my spouse or friends, but it's not as enjoyable due to constant position changes.
Oh, okay. Which we'll focus on a little bit as we go forward. And you're busy for retired though, for sure.
Yep.
And then I guess one of my last questions, just to kind of dictate where we want to take therapy. What do you want to get out of therapy? Like what is your reason you're here? Obviously for pain control, but what goals do we have?
My goal is to be able to do my prior activities like golf, volunteering, going out to dinner without having to worry about pain.
I like that goal. Let's see what we can do.
Mm-hmm.